Medication errors, common, harmful, but preventable. A medication error can be defined as any medical error that is related to a medicine that is used to treat a patient. It is simply a failure in the treatment process that can lead to harm to that particular patient.
In developed countries, 5 to 20% of hospital admitted patients experience adverse drug effects. Out of these, 20 to 50% are considered preventable, and among outpatients, 2% report adverse drug events, and out of all, 52% of adverse drug events are considered preventable.
In USA alone, 1.5 million patients were harmed and 7,000 patients died annually due to medication errors. And it was found in a study done by UK that medication errors occurred in all healthcare settings and at every stage of medication treatment. In fact, this study revealed that 16% of these errors occurred during prescribing, 18% of errors occurred during dispensing, and 50% of these errors occurred during administration of the drug.
Have you heard of Swiss cheese model? According to this model, lapses at different stages of medication causes medication errors. Factors related to patients, healthcare professionals, systems operating in healthcare institutions, and medications used gives rise to medication errors.
Large patient numbers, lack of reporting mechanism, lack of experience with regards to medication errors among healthcare professionals, improper storage technique, and poor medication literacy rate among the Sri Lankan public leads to medication errors in Sri Lanka.
Statistics on prescription errors are limited in developing countries. In Sri Lanka, most of the prescription errors occurs in writing the dose, drug, and the frequency. 10% of the medication errors have the potential to cause serious side effects.
Some medicines look alike and sound alike. Therefore, medication errors are common in these kinds of medicines. Not to mention, in the marketplace, for one generic name drug, there are many kinds of drugs that have different trade names. And situations like hospital admissions, transferring patients, and discharging patients may change the pattern of the patient's drug intake or medicine intake, which can later predispose to medication errors.
Nobody seems knowing how much of a disaster a medication error can cause. A child weighing 20 kilograms was prescribed 500 milligrams of paracetamol 3 times a day and was later admitted to the hospital with a liver failure.
A patient was prescribed 6 units of insulin, but instead was administered with 60 units of insulin. She developed severe hypoglycemia.
Instead of dispensing 40 mg of prednisolone for an asthmatic patient, 40 mg of propranolol was dispensed. The patient became breathless, went into low pressure, coma, and died.
So, as future doctors, what can we do to minimize prescription errors? So, the first thing would be to know your drugs well. Then, the right drug should be given at the right dose to the right patient for the right amount of time to the right route.
Some ways for medical professionals to ensure medication safety are: always prescribe generic names. Ensure that each and every prescription is tailor-made for the patient. Communicate clearly. Always double-check. Always report and learn from medication events. Use memory aids such as the DNF Medscape to find out information when your information is not at hand.
Some ways for healthcare professionals to make medication usage safer are: learn to collect complete medication histories from all your patients. Know high-risk medications and be cautious when you are prescribing them. Be thorough with commonly prescribed drugs. And also check with the 5 R's when you are prescribing, dispensing or administering any medication.
දීර්ඝකාලීනව ඔබ ඖෂධයක් ලබා ගනිද්දී ඉන් ඇතිවිය හැකි හානි අවම කර ගැනීමට රෝගියෙකු ලෙස ඔබේ කාර්යභාරය කුමක්ද? ඔබ ලබා ගන්නා ඖෂධය ඔබ ලබා ගන්නේ කුමන රෝගී තත්ත්වයක් සඳහාද යන්න පිළිබඳ උපරිමයෙන් දැනුවත් වන්න. ඔබ ලබා ගන්නා ඖෂධයේ ඖෂධීය නාමය මනාව හඳුනා ගන්න. ඖෂධයේ හැඩයෙන් හෝ වර්ණයෙන් පමණක් ඖෂධය මතක තබා ගැනීමෙන් වැළකී සිටින්න. ඔබ ඖෂධය ලබාගත යුතු නියමිත මාත්‍රාව පිළිබඳ දැනුවත් වන්න. පෙති ගණනින් හෝ කරල් ගණනින් ඖෂධ මාත්‍රාව මතක තබා ගැනීම ඔබට හානි කර විය හැකියි. එමෙන්ම ඔබ ඖෂධය ලබාගත යුතු වාර ගණන පිළිබඳව හොඳින්ම දැනුවත් වන්න. දීර්ඝකාලීනව ඖෂධයක් ලබා ගැනීමේදී එම ඖෂධය තුළින් ඇතිවිය හැකි සංකූලතා, ඔබ ඖෂධය නැවැත්විය යුතු අවස්ථා, ගර්භණී සමයේදී ඔබ එම ඖෂධය ලබාගත යුතු ආකාරය ආදී කරුණු පිළිබඳ ඔබේ වෛද්‍යවරයාගෙන් අසා දැනගන්න. ඔබ ලබා ගන්නා ඖෂධය පිළිබඳ සම්පූර්ණ දැනුමක් ඔබ සතුව තබා ගන්න. මේ තුළින් ඖෂධ තුළින් ඔබට සිදුවිය හැකි හානි අවම කර ගැනීමට ඔබට හැකියාව ලැබෙනු ඇති.